Well, good afternoon, everyone. It looks like we're at the top of the hour, so we're going to get started. Hello to everyone who's joining us today, and thank you for being with us. My name is Jen Cooper, and I'm from the Association of Public Health Nurses, also known as APHN. I first would like to thank our partners at the Midwestern Public Health Training Center for their help in hosting this webinar for us today. I do want to mention that we will have a Q&A session at the end of the webinar, so if you could hang on to your questions, and you can even type them into the Q&A box, which you'll see an icon on your screen, probably at the top or the bottom of your screen, and you can type them into that box so that we can view them and collect them. So thank you for doing that. The focus of our webinar today is about the Million Hearts Initiative. If you're not familiar with that initiative, it's a joint CDC and CMS effort that launched in 2012. And one piece of this initiative included ASPO's Million Hearts State Learning Collaborative. And that state learning collaborative funded 20 states as well as the District of Columbia and Palau. And their goal was to help save lives by preventing heart attacks and strokes through blood pressure control. So today we are proud to have one of these teams from the State Learning Collaborative. It's the Wisconsin team with us, and they're going to present today on how they are collaboratively tackling undiagnosed hypertension in Wisconsin. And if we could go to the next slide, just to give you a snapshot here of who we are. This is our team photo, and the Wisconsin team was at APHN Spring 2017 conference in San Diego. So just to introduce all of us from left to right, we have Rebecca Thompson from the Wisconsin Community Health Fund. We have Roanne Warden, the nurse and director of the Greene County Health Department in Monroe, Wisconsin. You see me pictured there in the middle with the heart, holding the heart. And then Chris Wisniewski, she's also a nurse, and she's the parish nurse coordinator of the Monroe Clinic in Monroe, Wisconsin. And then also we have Rebecca Cohen, who is the health systems coordinator at the Department of Health Services for the state of Wisconsin. So with that introduction, I'm going to turn it over to Rebecca Cohen.
Well, thanks, Jen. On behalf of the Wisconsin Million Hearts team, we really appreciate the opportunity from APHN to present today. We are excited to share some information about how Wisconsin is building its community and clinical linkages to address hypertension from a population and community perspective. Today, we are sharing our successes and lessons learned from Greene County, which was one of our 3 sites. For 2 years, Wisconsin was a participant in the ASPO Million Hearts Learning Collaborative, and we are looking forward to talking about our community clinical linkages for hypertension prevention strategies. We just want to say that we have no outside financial interest. As you see on this slide, it is your learning objective, and I'm not going to read them to you, but I just want to say that we are going to be looking at community clinical linkages that were built between the local health department, the health system, a community health clinic, and the coalition, and focused in a rural setting. Also, we're going to be hearing from our parish nurse and our public health nurse in terms of how did we expand and really strengthen team-based care. We're going to also look at our EMR and our HIT tools and how data was used. We're going to introduce how the local health department has been embracing the community chief health strategist role for Greene County. And finally, also, we're going to look at the linkages to improve hypertension and other chronic diseases through the CHA and the CHIP practices. We have been aligned with the CDC Million Hearts campaign through our hypertension work. We have been focusing on our work with the ABCS on the health information, HIT, and looking at innovations for our work. We have in Wisconsin several Million Hearts champions. I'd like to toot our horn a little bit, which is one of our physician champions in the Million Hearts National Campaign is Dr. Chris Tastian, and his clinic, Ellsworth, Wisconsin Clinic, has also received a Million Hearts award, along with Beta Care, one of our health systems, who's achieved also a Million Hearts award. Next slide. As we look at the national Million Hearts goals, with the Million Hearts, the goal, of course, of the Million Hearts campaign, is to prevent 1 million heart attacks or strokes through prevention and control of hypertension. Well, with that said, Wisconsin seeks to save about 3,000 lives over this 5-year campaign. As you see on this slide, there are 3 priority areas. First, keeping people healthy. And as we do our work here in Wisconsin, we have focused particularly in decreasing the tobacco use, increasing physical activity, and increasing people's dietary habits to include more fruits and vegetables in a healthy diet. Secondly, optimizing care. Wisconsin has chosen to really focus on blood pressure control, as we're going to share with you, along with smoking cessation. Finally, looking at improving outcomes for priority populations, we are focusing on all of these areas to improve hypertension and cardiovascular outcomes. Next slide. We also developed some of our own marketing campaign fact sheets, and I'll draw your attention to we estimate there are approximately 1.3 million adults in Wisconsin who have hypertension, and less than half of them are in control. And also, a large number, between 20 to 40%, are unaware that they even have hypertension. Next slide. We know also from our facts that women are really unknowingly the highest population that is impacted by coronary disease in Wisconsin. So we're really focusing some of our efforts with women. As we look at our work in Wisconsin, the Million Hearts campaign is really umbrellaed under our Heart Disease and Stroke Alliance. Million Hearts Wisconsin connects to the CDC national program, and we work with our chronic disease prevention program work through our CDC 1305 grant. It also connects with the Wise Woman program. It connects with our state health plan, Healthiest Wisconsin 2020. We focus also and connect with quality improvement in our accreditation work, and also on our work through our health departments for their community health assessments and their tips. We were fortunate to be a participant in the ASTO Million Hearts Project, which ended in 2017 of this year. Wisconsin was able to incorporate hypertension prevention and management approaches, and it continues its work to improve hypertension and cardiovascular outcomes. With our work in this project, we were able to create protocols that we could share with other local health departments, and we're going to hear more about that work. We were able to focus and strengthen our team-based care, where we used EHR data to find patients hiding in plain sight, and we're going to hear more about that work. And also to talk about how we can use the data within the EHR and how we can link that connectivity to through EPIC with our local health department and the health system. Well, this is our Wisconsin ASTO Million Hearts team. Again, our team is created from many, many partners, which included the American Heart Association, the Pharmacy Society of Wisconsin, the Wisconsin Nurses Association, WEA Trust, which is our insurance provider. And so we just have to say that we think that this was a very good opportunity, and it helped to really reinvigorate the work with our local health department. Now I'm going to turn it over to Rebecca Johnson of the Wisconsin Community Health Fund.
Thank you, Rebecca. Good afternoon. This is Rebecca Thompson with the Wisconsin Community Health Fund. We're a new prevention fund that is working to grow and focus resources for health improvement. We are here today to tell you about an exciting project in Greene County, Wisconsin, where you eat, drink, and yodel, home to famous cheese, beer, and Swiss culture. To begin our rapid heart health strategies linking community and health system partners, we began with the local public health department, Parish nurse program, a community clinic, and the health fund serving as the coordinating role, helping to design innovative opportunities for hypertension outreach in connection to the Monroe Clinic, our local health system. So why is this project important? Presented on this slide is a community health value exchange model, which shows a required balance between healthcare and community health support services to achieve healthcare value, which is defined as the right service at the right time, at the right cost, and the right outcome. An important focus of this model, which you will note at the bottom ring, is community clinical linkages, or the balancing of healthcare, prevention, and self-management. Specifically, the Community Health Fund, as a partner and project coordinator in health, is working to help link various sectors, including philanthropy and business sectors, to this work, and ultimately helping to grow resources to balance the healthcare value exchange. To begin our local project, we started with the development of a hypertension community care protocol that is based on American Heart Association guidelines and connections from the community to the health system. To further share the story and findings from our project will be Roanne from the Greene County Public Health Department.
Thank you, Rebecca. I'm the director of the Greene County Health Department, and prior to that, a public health nurse for 15 years. Greene County is located in a rural area of southern Wisconsin that borders Illinois, Wisconsin. We have a population of close to 37,000 people. Our department is staffed with 4 public health nurses, a part-time dietitian, and 2 support staff. We provide the typical public health services of a small county health department. One advantage, I would have to say, in being a smaller department is sometimes we can be a little bit more innovative and nimble when working with projects such as the Ask a Million Hearts project. Our department's role in the project seemed fairly simple. We were going to identify people in our county who were unaware of their high blood pressure and connect them to care for treatment. Our initial target population was going to be low-income population, and we were going to identify them by going out into our communities by doing blood pressure screening. On this slide are Rebecca and I at our first blood pressure screening event in the Walmart parking lot during a community service awareness event. The Neighborhood Health Partners of Southwest Wisconsin Community Action Program was another community partner in this project. This community health clinic provides mainly family planning services, so conducting blood pressure screenings were already a part of their services. This is a picture of Jackie, the nurse practitioner who runs that clinic in Monroe, Wisconsin. Jackie found actually working with primarily young women during their family planning visits was an excellent time to talk about heart health, and education could easily be incorporated into those routine visits. At the start of this project, the parish nurses, who you will hear from a bit later, and the public health nurses worked together on several different fronts. The first was our training. We needed to make sure we were taking an accurate blood pressure since we were reminded how very critical this was. The Monroe Clinic advanced nurse practitioner who worked in the cardiology provided us with excellent training on the most up-to-date blood pressure management techniques. Another area that the parish nurse and public health nurse worked together was where we could offer blood pressure screenings where and when throughout our county. Thirdly, we created and shared professional and client educational resources with one another. We updated our blood pressure policy and protocols and made changes to them after several plan, do, study, act cycles. This was a significant aspect of the ASPO project, was the quality improvement process work. So what did we learn from our work? First, public health involvement is key to developing a community care protocol. Public health truly is in the best position to lead or guide this type of work. Secondly, blood pressure screenings can easily be incorporated into existing public health programs or activities that you might already be doing. Our department provides adult immunizations, so we included a blood pressure screening with this service as well as a fall risk screening, and it was well received in our community. Really, health screenings, we found, open the door for us to converse and connect with people to other needed community support. Since we know how to do that already very well, when appropriate, we made referrals to our healthcare providers, to our Wisconsin Tobacco-Free Quit line for information on mental health services and food programs like the supplemental food assistance and local food pantries. Third, we found income and health insurance status was not as much of a significant predictor for identifying people with high blood pressure as we first thought. In fact, when we held our blood pressure screening event for our very own Health and Human Services staff, we found a significant number of us had undiagnosed and uncontrolled hypertension. Boy, did we have our work cut out for us. Hypertension and heart disease impacts a large percentage of our population in Greene County. In fact, as Rebecca indicated, 1 out of 3 adults in Wisconsin died from heart attack or stroke. Our last lesson learned that I would like to mention was communication between our community partners and the healthcare system. This is very critical and yet can be very challenging. It takes really time and skill to coordinate effective and good communication, and having a good positive relationship with your healthcare system will get you much further ahead in your population health work if you really work on this relationship. So through our work on this project, I have seen how public health is well suited to assume the role of chief health strategist. We may not be center stage, but we can certainly guide and bring resources for change, for improving our population's health. We have a focus on prevention. We know how to bring stakeholders together, and we know how to prioritize health needs. In Greene County, our health department, right along with our primary health care system, Monroe Clinic, leads and conducts our community health assessment and improvement plan. This is done under the umbrella of our Greene County Healthy Community Coalition. This work together helps position us to develop a community health protocol for hypertension. If you are a public health department who is working towards public health accreditation, we have identified a few examples that would certainly connect this work to domain 3, 4, and 7, as you can see on this slide. One example I'd like to point out for domain 7, this evidence would be when we collaborated and partnered with Monroe Clinic to establish a bi-directional referral process. And this would serve as evidence for promoting strategies for improving access to care. Now, I'm going to turn the program over to Chris, who will share information on parish nursing and the role that they had in this ASPO project. I would like to add that Chris has taught me a great deal about parish nursing and shown me what a valuable partner they can be. I would highly recommend that if you don't know if you have a parish nurse program in your area or who they are, that you ask around and invite them for coffee. Chris?
Thank you, Roanne. And yes, it's a pleasure to be here, and I appreciate having the parish nurses included in our presentation. So a little bit about parish nursing. The first thing I'd like to say is it is a professional practice of nursing with scope and standards defined by the American Nurses Association and the Health Ministries Association. And actually, just in September of 2017, the third edition of the scope and standards came out. So they're right off the press, and we've been distributing them to our parish nurses in the ones that I've been working with to make sure that they're up to date. In order to be a parish nurse, you have to be a registered nurse with a current active license in the state you practice. And so, as Roanne said, we have faith community nurses. We're right on the border of Wisconsin and Illinois. So I have nurses both from Illinois and Wisconsin. And some of them have both licenses because their churches cover both states. The focus of the practice is really whole person health, mind, body, spirit, really looking at prevention of disease and how we can help people obtain a healthy lifestyle. And actually, the history of parish nursing is about 30 years old. We celebrated our 30th anniversary in spring of 2016. It began in Park Ridge, Illinois, and is now national and international. Our Westburg Institute, which was formerly known as the International Parish Nurse Resource Center, is now located in Memphis, which is their third home. And they do a lot to try to continue the process of making sure people understand this is a professional practice of nursing. And one of the things, next slide, please. Oh, and actually, can you go back once? The picture shows you four parish nurses, actually 5 parish nurses. The gal in the middle, her name is Vicki. She was very helpful in doing the blood pressure screenings with me. And I just wanted to point out, we do have a man who is a parish nurse. And actually, we had 2 men that were parish nursing at one point in time. So if there's men nurses out there, they're certainly invited to be part of that practice. Okay, Rebecca. And so they did develop an education curriculum over the last 15 years. Basically started with Rosemarie Mathis as Marquette University. She participated in that development, as well as Ancillary Twadell, who was from the International Parish Nurse Resource Center at the time and out of Loyola. And our current curriculum is what you see in the corner. The book is called The Foundations of Faith Community Nursing. It is evidence-based. It's been revised several times. And it's an intensive 32-hour course used for new people looking at becoming faith community nurses. So they are educated in that whole process. And Wisconsin has purchased that program, and we are offering it several times a year. Next slide, please. So parish nursing at Monroe Clinic, when did that begin? Actually, it was proposed in 1997, and we are celebrating our 20th year. I've been the parish nurse coordinator now for 15 years, starting in January of 2002. There's several models of faith community nursing or parish nursing. One's an unpaid model and one's a paid model. In the rural areas, what we find most often is it's an unpaid model where the nurse will either volunteer her time, her or his time at the church that they belong to, or outside the whole community. So for instance, we have a small town called Albany, east of Monroe, and there's one faith community nurse started at the Catholic Church and now is helping at all 4 little tiny churches in that community. They have multiple roles, but one of them is to be a health advocate, and so advocating for healthy lifestyles and those kinds of things, and health education. And currently we have 16 faith community nurses that are interested, or other interested nurses working with me with the Monroe Clinic Parish Nurse Program. So the project connection, as Roanne stated, we did a blood pressure competency training with the Monroe Clinic's cardiology staff and public health. And it was kind of interesting, I think, and Roanne will testify to, you know, we've all been in nursing for quite a while and we've all taken blood pressures a little bit differently. So getting on the same page, looking at it as a consistent process was important, and we all learned from that, I think, which was kind of an interesting thing. We also did motivational interviewing education, and that was important because it really helped to show the nurses how to improve their listening skills and what our clients really understand as blood pressure versus what we think they understand. And it's sometimes two different stories. We were also part of webinars and phone conferences, and we did a lot of blood pressure screenings. So in 2015 through 2016, we did about 81 screenings in different churches, several in Monroe, and then in other little tiny towns, Broadhead and Albany, as I've noted on the slide. And actually, of those numbers, probably about 15 or 20 people were referred to if they had a physician to be followed up, or if they did not, we helped them find one through the Monroe Clinic's triage program. Some of the challenges of faith community nursing being part of this was actually the number of faith community nurses we have that are entirely faith community nurses and don't work somewhere else. Most of our nurses work somewhere else, so the only day they have available is Sundays, and that's the days we try to do the screenings. And when we did do the screenings, a lot of the churches are not really physically, the environment is not physically supportive of that. In fact, we did one screening in one large room, and we had probably 25, 30 people come to it, but there was no access for privacy. We did it in like January, it was cold. One of the things we learned that when you do a blood pressure, you need to take the blood pressure directly on the patient's skin, and these people would come in with several layers of clothing on, and then there was no privacy to ensure how we could really do that. So that was kind of always a little interesting to how we could do that best. Also, what people, and I'm sure Roanne sees this too, what do people really understand what blood pressure is or high blood pressure? There's lots of different things they think it is. And when you do the screenings, there's limited time and space for any kind of education. So I think the resources that we put together were important to hand out, and people had questions, they could always contact us again. And then we have what I call my little guy, the blood pressure shopper. And he is a person that goes from one blood pressure screening to the next looking for the best number. And then he would come back and say, Chris, you didn't get me the right number. So, and those are the people that understand hypertension is a problem. And so one way they try to work with that is to find their best numbers. So it's kind of a cute little thing, and sometimes, although sometimes very concerning, because again, people don't understand that blood pressure measurements change throughout the day. And then moving forward, what we'd like to do is, since the grant did, and we still, I think, found that doing blood pressure screenings was important, both for faith community nursing and public health nursing. We had kind of gotten away from that. And I think moving forward, we'll continue to look at doing more screenings and seeing if we can identify more people with undiagnosed or untreated hypertension, or people who are not responding to the treatment they already have. Because I'm the parish nurse coordinator with the healthcare system, the Monroe Clinic, I did have EPIC accessibility to report hypertension, the numbers to our triage nurse related to certain patients so that they could do follow through. We also work, the faith community nurses work a lot with what's called the Wisconsin Women's Health Foundation. They do a program called Grapevine, which is an educational program, health educational program for women. And there is one on heart disease in women called Know Your Numbers. So we've been able to provide that in several different places. We're hoping to continue to look at training on an annual basis, as well as calibrating the machinery, because again, some of the blood pressure cuffs that we had were pretty old. So that's just pretty much how we worked with the program. And again, it was a big honor for the faith community nurses to be part of this. So Rebecca Thompson, I will introduce you next.
Thank you, Chris. This next part of our presentation, we're going to shift to the hospital learning that occurred through this community clinical linkage project. So through connection and attention to the ASTO project, the Monroe Clinic, the local health system, was able to place hypertension as a priority on their quality agenda. The Monroe Clinic historically has always been considered a high performer in Wisconsin for hypertension management, with control rates in the 80th percentile. But they are always willing to strive for improvement, and this project really helped to elevate the status of that as a goal. In addition to including hypertension as a focus on their quality agenda, they also utilized the Million Hearts Prevalence Estimator tool, which can be found on the Million Hearts website, which showed that their detection rates were on track for estimates based on their population. Next, to really dive into how to help heart health improvement strategies in the hospital setting, the primary care team from the health system began with a dissection of the health system's hypertension systems, looking at the process of assessment, diagnosis, follow-up, and control, and interestingly found that there were a large group of blood pressure measurements that read in the 140/80 category. So was this accurate? Was it correct? They really didn't know, and it caused them to really dive in and try to investigate and find out more information. From the Value Stream Map, the primary care team began to prioritize Thundercloud challenges, including the importance of getting back to basics, starting with proper measurement of blood pressure, standardized training throughout the health system to all levels of providers, regular equipment calibration, and later, the creation of an all vitals program, which encouraged blood pressure measurement throughout all specialty care visits. A very exciting outcome of the project was the development of the Epic CareLink system, the first electronic healthcare system exchange between a public health department and a hospital in Wisconsin, offering bidirectional communication connection and feedback. As you can see here, this is Roanne at her desk, electronically communicating with the local health system. So historically, exchanges of this type occurred through faxes or phone calls and didn't seem adequate, safe, or really offer the proper opportunity for feedback. Oftentimes, many patients were lost in the system for follow-up or not able to connect directly to care when they needed it. So this new system, while very basic, is sleek, timely, and offers great opportunities for expanded communication and better care. In addition to the health system connections, the local community health coalition responsible for the area's community health improvement plan was also involved and helped to gather support of over 20 multi-sector partners in the project. The coalition this week launched a website to share various community care policies like the one developed for hypertension. Next, we wanted to share some of our community health promotion concepts to help you think about ways in which you may gather partners and help to spread important heart health work. First is a hypertension community care partner worksheet, which challenges a community to explore its various partners and assets and their current involvement or potential involvement for a heart health campaign. This next sheet shows hypertension community care agreement that is a template that may be adapted in a community to help draw in and officially recruit partners as part of your hypertension improvement team. Next, we have some examples that were digitally shared to help promote some heart health education events, as well as the usage of social media to help spread additional heart health information. In the month of February, we took advantage of Heart Health Month and engaged schools and medical residents as part of a Rural Health Day as additional opportunities for hypertension education. As part of this effort, a heart fact sheet was created for kids with the goal of connecting to local families through the school systems. The media was also a very important partner, helping to share community health education, but also was a great opportunity to help highlight and recognize the work of the various partners in this campaign community effort. So in summary, this has been a wonderful project and learning experience with connections to national, state, and local partners. We are very grateful to ASTO, APHN, and the Wisconsin Department of Health Services for making this project a reality. Their support and encouragement have helped to spark many new levels of thinking and work at the community level. Important project reflections and lessons include a number of highlights, which are noted in this slide. First being the creation of a broad mix of community and hospital partners is really important in developing strategies for population-based care. We gave you some examples of a hospital, a public health, community clinic, parish nurse, as well as an independent coordinator helping to facilitate new strategies for improvement. Next, when wanting to try out a new improvement strategy, we really learned that starting small and simple is the best way to go, and that bigger is not necessarily better. Also, to consider identifying other spokespeople and leaders in the community who can be a voice and support for enhanced community care, helping to elevate public health as a chief health strategist and engaging and directing other partners in health improvement. A very exciting finding, again, in this project was the opportunity to integrate new practice initiatives into daily activities, thus sustaining the continuation and expansion of this work into the future, and really working to create new workflow norms. The connection to the national campaign, the Million Hearts, really helped to bring priority, clarity, and connection to this work's purpose, and was very helpful, especially with bringing in new partners and being able to reference CDC and CMS and the national goals that we were linked to. And lastly, this project assisted with further expansion of electronic community clinical linkage systems, which may provide countless opportunities for communication and improved health. To also assist you in your heart health improvement journey, we've listed a few resource slides for you. This first one is a summary of some resource tools in Wisconsin, as well as some national resources that may be useful for you. So we hope that you can go back and possibly use these slides again for a template for motivation for improvement. So in the end, we just want to say thank you again for listening to our hypertension improvement journey in Greene County, Wisconsin. We hope that some of these ideas presented today may be referenced to assist you with sparking some new avenues of thinking for important future community clinical linkage work. As we know, it really takes one heart and one community at a time. Thank you.
Well, thank you so much to the whole team and for all of you being present today to be able to share your different roles and some of your outcomes. One of the things that has really impressed me about the team is just how collaboratively they have worked. And I really appreciate Roanne's comment about how the work really helped to reinvigorate the work of the local health department. And I think that's important. We want to just give you an opportunity for the participants on the line, if you have questions, to type them into the Q&A box. Or if you have anything you'd like to discuss or clarification on anything that our presenters spoke about today, look for that little Q folder and you can type your questions in right there. I wanted to also just say that I appreciate how you've told your story here today. I know one of the things that APHN is trying to do is find stories like these related to Million Hearts where partners and public health nurses and parish nurses working together have been able to achieve some of these outcomes like you described today. So I appreciate you telling your story, both at our conference and here today. I see that there's a question here in the box asking if the PowerPoint presentation can be accessible to us. We certainly could, if it's okay with the Wisconsin team, we can share that on our on the APHN website. We have a Million Hearts resource page on that website. So would that be okay with the Wisconsin team if we do that?
Sure. Yeah, absolutely.
Okay. And I know to also answer the question, maybe it was before this or if it's after this, there will be a slide as well that has the contact information of all of our speakers today. Thank you. If you have anything specific, but we will post them. Deborah, thanks for your question. Lacey also asked, how did the high school kids receive the information from 1 Million Hearts? How did they respond to the information given to them?
Oh, thank you for asking. It was actually a great project, and we only did it with one school system, but we'd like to further spread it throughout the county, and we now have the tools And I think they found it to be interesting. They got really into wearing red, the one picture that you saw with the heart around it, that sort of sparked their interest. And we know that in addition to the heart health fact sheet that went home with the children, we also had an article in the newspaper that week. So it was sort of double reinforcement. And I think the schools are definitely interested in getting more active in healthy living movement activities, but they need guidance and support. So this was a great entryway, and I think through other different touches with them that, again, those types of philosophies will become more mainstream.
And I would just like to add too, once upon a time, some years ago, we don't necessarily think of children with hypertension, but I was asked by a pediatrician when I did a parish nurse program at the local Catholic church, which had a school, and we were monitoring a second grader who had hypertension, and her blood pressure was pretty high, actually, for like about 140 over 90, and we took her blood pressure every week for probably the whole semester trying to get it under control. And that was a second grader. So we really don't think about it as involving children, but it certainly has its impact.
Thank you, Chris and Rebecca. At this point, we don't have any other questions unless there's someone that wants to type something into the chat. While I'm allowing time for that, for anyone else who wants to ask a question, maybe you can speak a little bit to, for those of you that are working in Greene County, what are some of the future steps in looking at heart health now that the ASTO project's over, but you've started all this great work and had some outcomes? What do you see as future steps?
So this is Roanne from the Public Health Department. Where I see future steps moving is really taking the work and furthering it, like Rebecca mentioned, into additional schools, looking at our pharmacies as another avenue, as well as chiropractors, dentists. We know a lot of these services are providing the blood pressures and getting the word out to them of the importance and what we've learned, as well as, and what's really exciting too, is to really look at the electronic medical record connection, and not only through just the hypertension project, but expanding that into other health areas, whether it be in public health, breastfeeding, lead, diabetes work, physical activity. So just really expanding that connection and being more comfortable with that system from the public health aspect of it. So those would be my two priority areas to really further develop, and utilizing now our Greene County Healthy Community Coalition website as the forum for sharing the resources that we've created through this project and getting them out on a more widely county-wide basis. Thank you.
This is Rebecca Thompson from the Health Fund. One other point I wanted to highlight regarding the health system was a successful element of this project we didn't highlight before was the identification of one case manager at the hospital system. That's really been a vital link to really making the community clinical linkage link work, and would encourage everyone to not only, as Roanne said earlier, foster that relationship with your local health system, but look for a champion, someone who can be that liaison. And we look forward to expanding that role with the liaison, and we're also looking at more usage of electronic health information data to help identify more potentially patients at risk who may not be diagnosed.
I just wanted to add, there's another question that came in. Lacey, same who asked the other question about the high school kid, says that she goes door to door here in Greene County, in her Greene County, Missouri, doing blood pressure screenings as well as community events. Have you ever thought about doing that in Wisconsin?
So this is Roanne again from the Public Health Department. We have not gone door to door. I don't believe we wouldn't have the capacity to do that. However, we do offer blood pressure screenings at a number of community events and health fairs when invited to do so, or we've sought them out actually. So.
And in watching Roanne practice, I think one of the real learning points was that trying to integrate blood pressure measurement into more of her daily work has really been a more long-term effective strategy, because she's been able to follow up and really develop a more personal relationship. Whereas the outreach events are helpful and they do help get education out, the ability to follow up and really provide ongoing care and assistance can be challenging at times. So the integration of this into more daily workflow has been the long-term goal for what we're working to achieve.
Mm-hmm. Thank you. Thank you. I just also didn't want to miss a comment here from Christine, who has asked about the slides and the recording. Christine, we are recording this, so we are using the Midwestern Public Health Training Center platform for the webinar, so we can get a link from them, and I'm glad to post that on APHN's website with access to the slides and the recording. I'll work that out with the Midwestern Public Health Training Center. So thank you for asking. We will make this available. And thanks, Christine. They made a nice comment that this is a great presentation, so she wants to be able to share it. So thank you for that. So I know we talked a little bit about future steps for Greene County. Maybe you could speak specifically before we leave today, is some future steps for Million Hearts across the state in Wisconsin. What are some thoughts you have on that?
Well, this is Rebecca Cohen, and along with the work of my partners, one of the things we want to do from this project is to take the protocols that were created and developed with Greene County, along with our other public health partner, West Dallas, and we're creating a toolkit. And we've had many requests from other health departments that are interested in establishing or revising their blood pressure improvement protocol or the blood pressure screening protocol. How are we going to, better do that? So that's one of the ways that we hope to take this work and to spread it. Some of the other efforts that this project helped to launch, and Chris and Roanne shared with us about the blood pressure measurement accuracy training that they took. And through one of our partners, Metastar, on their website, we now have a blood pressure measurement improvement e-learning course that anyone can take. So again, we learned the value and the importance of taking an accurate blood pressure. I also have to call out our other partner, who is the American Medical Association, AMA, and our partner, Linda Murakami, one of their specialists who help us also do our work in this particular area. Building upon that e-learning module, we are also working to create, and it'll be out in a few months, the self-measured blood pressure e-learning tool. How does a nurse, how does a medical assistant, how does a parish nurse work with a patient to teach them to take accurate blood pressure measurements? So that's an important piece. And then we know that we want to also really push out the Epic CareLink module, and other areas of the state are working on this. It includes West Dallas and the Aurora Health System, and I know some other parts of the state are also working on that critical electronic link for bidirectional referral. We also, through the Million Hearts campaign, are going to continue to work on team-based care. We know that this is an important piece to grow community clinical linkages. Again, that's where that Epic CareLink can be critical, so that the pharmacist in the community can also access that information, make that referral back, incorporate medication review for medication therapy management, so MTM. We know that a lot of this work is out there. We know that health systems are doing a really fine job to implement team-based care, but we also know that it's important to focus on the quality improvement aspect of it. And how do we follow up with those patients? And how do we create the registries to get those people that are identified with hypertension and diabetes into that care and to do that self-management that we know is so important. And finally, it is finding those patients within those systems that are hiding in plain sight. And we've done our work with FQHC in this project with 16th Street in Milwaukee, West Dallas area, to look at the Hispanic Latino population. And we found that by going through and doing the data queries, that there were people that had at 1 or 2 high blood pressure readings that were undiagnosed. So health systems are very interested in finding those persons that are in their own systems to provide that care. So many health systems are now on board. One of our partners, Wisconsin Collaborative for Healthcare Quality, is also going to be addressing this with their partners. So we're excited for the future efforts for Wisconsin Million Hearts.
Thank you, Rebecca. And I don't see any more questions here in the chat or in the Q&A. I just wanted to mention, I know that this sounds like now it's kind of part of the fabric of the work that you're doing, both in Greene County and across the state with Million Hearts across the whole state of Wisconsin. So just wondering if you have any other thoughts about at the state level public health or in some of the other local health departments. Do you see this continuing, or what are some next steps that you might want to share about that?
Thank you, Jen. We're actually working to develop some new goals for the revised Million Hearts 2022 campaign, and we're looking at using the months of February and May for some specific promotion. And we're gathering some of our highlights of learning, as well as some of our close partners like the Pharmacy Society, the Nursing Association. We met today with our tobacco control partners and working to integrate a package of multi-strategies that may be promoted. So if a community or a health system wanted to test out or take on something new, that they would have a variety of things they could pick from. So that will be our next step. We're also looking to help grow ways that we can actually collect measurement of blood pressure. We have a wonderful quality improvement organization in our state called the Wisconsin Collaborative for Healthcare Quality. And they have a number of members that represent roughly 65% of providers across the state. However, there's still, roughly 35% that aren't included. And how can we best reach those? Those are most likely in rural and maybe smaller, not as sophisticated areas. And we'd like to explore strategies to be able to integrate them not only into the improvement efforts, but also to start to begin them thinking about how to collect data so that we can better share and spread our story and message, and also so we know where to target improvement strategies. And the last piece that I would state is we are starting to look at using data from mapping as well as our state epidemiologists to look at priority populations who are most at risk and how we can best engage those groups in improvement. So those will be some of our strategies moving forward, as well as growing partners and seeking out new avenues of resources and funding to support this work.
That's great. Thank you, Rebecca. And we certainly have learned a lot from you today, and that's what we hope to do by having webinars like these, is share the work that other states are doing and other communities, so that we can think about how that may fit into the work that we're doing in our own communities. So we appreciate all that you've shared. Again, the slide that's here has all the contact information and names for the Wisconsin team members that spoke to us today. We will post the slides, as well as either probably a link to where you can listen to the slide recording of the webinar today as well. And you can certainly reach out to us if you have any further questions. So Again, thanks to Rebecca and Roanne and Chris for being with us today. And we hope that you all have a good week. Thank you all for being with us today.